Hi, I'm Jonathan from Gore Physio. One of the questions that I'm asked most frequently in my clinic is, what are the types of things that you see most often? What are the injuries that you commonly help people out with? And the shoulder is right up there with back pain and knee pain. And when you think about it, it's pretty easy to understand why. The shoulder, it initiates most of the movements of the hand and the arm. It's very mobile. It's a ball and socket joint, so it relies on muscles and tendons to not only perform a combination of movements, but to also provide stability to the joint. I'm going to talk about two important structures of the shoulder. The first one is the rotator cuff. You've probably heard this term before. The rotator cuff is a group of muscles and tendons that perform many of the movements of the shoulder. It gets its name from the actions which it performs, one of the main actions, which is rotation, and the configuration of the tendons around the shoulder forms something similar to a cuff, so it's a bit like that. The rotator cuff it's susceptible to, well, the tendons of the rotator cuff muscles are susceptible to wear and tear over time with use and with age, and also they will most commonly be strained if you were to fall on an outstretched arm or you had your arm pulled back in an awkward position. The second structure of significance is something called a bursa. So a bursa is a fluid-filled sac. It's located at the point of the shoulder, around there, and the purpose of the bursa is to prevent friction from accumulating between bone and tendon, but it can in fact get irritated itself, and then it will swell and it starts to impede movement. So two common sources of pain in the shoulder are the rotator cuff tendons, and the bursa. When a bursa is inflamed, it's called bursitis. So you might have heard that term as well. The pain that can be experienced when either of these structures are involved, or general shoulder pain, it can vary. And in the early stages, it might be something simple like reaching into a cupboard, or lifting things up, and there can be weakness associated with the pain. Their classic actions are reaching to put on a seat belt, fastening or unfastening a bra strap, and putting your hands into your back pockets. When worse, it can be noticeable with lower grade movements, like simple things like using a keyboard, and lying on the side can be painful too. If left to exist for a period of time, or a prolonged period of time, then it can develop into frozen shoulder. And frozen shoulder is a condition which is pretty unpleasant. It's very painful, and there's pain with most movements of the shoulder, and movement is really restricted. So when addressed early, physiotherapy can ease pain quite easily. If it's been there a little bit longer, like 4 to 6 weeks or more than that, then a more comprehensive course of treatment is required, because then not only are you dealing with pain, but there's also restriction of movement, and so that needs to be worked on to improve flexibility of the joint. In the case of frozen shoulder, then injection might be required for that. So I'm going to tell you a few things that you can do to help ease pain, and a few things that you should do to stop aggravating shoulder pain any further. Movement is generally always good, so you want to encourage repeated movements in any directions that are pain-free. Also be mindful of certain tasks that can be easily done with the other hand. So often these are tasks, if you're suffering pain on your dominant side, then it's tasks that generally tend to be done reflexively or subconsciously. It's just done out of habit, and these can be small things like lifting a kettle, opening a door, or lifting an item off a shelf. So just have a go at just monitor those things, and consciously try to use your other hand when doing it. Another thing which is worth a try is actually, if you're a computer user, to change the button settings on your mouse and have a go at using that in the non-dominant hand. It takes a little bit of getting used to, but it's definitely worthwhile if you're suffering shoulder pain while using a mouse or a keyboard. If you've had a period of intensive use of the shoulder, or at the end of the day, it's worthwhile putting ice on it for 10 minutes, cool it down, take some of the heat out of it, help to ease inflammation. And for sleep positions, obviously avoid sleeping on the painful side, and avoid sleeping on your front. If you're the type of person that gets comfortable lying on your front with your arm above the head, try to stop that pattern of activity. This type of position here, that will pinch and compress the tendons. And if you are comfortable enough to actually fall asleep in that position in the first place, chances are you're going to be woken up with pain, and when you go to move, it's going to be quite painful also. If sleeping on your back is the problem, then try having your forearm rested on a pillow, and or alternatively place a towel behind the shoulder blade, and that will help it to sit further forward. That takes some strain or some tension off the front of the joint, so that can be helpful as well. If you're a gym user, then avoid pressing weights above the head. Also avoid repeated actions, and push-ups and dips are a no-no. Don't try to work through the pain. Your body is giving you messages which you need to listen to. So the best course of action is to seek physiotherapy early, get a diagnosis, get started on fixing it, and ultimately avoid the need for an injection or possibly even surgery. Now, if you've enjoyed this video, if you found it helpful, or well, please like it. And also, if you know someone who would benefit from the information within them, please share it with them or tag them in.